Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Mudupe. Sound Health airs every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues from around the world. Today we are looking at a disease outbreak, diphtheria. The Nigerian Center for Disease Control has increased surveillance following the outbreak of this disease in some parts of the country. The conversation will continue after this break when a public health physician will give us updates on this trending issue. Stay tuned. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Folake Kofo Idowu, an infectious disease and public health specialist, and she is going to tell us all what she knows about the diphtheria outbreak in Lagos and Nigeria. Good evening, Dr. Kofo Idowu, and thanks for joining us.
Good evening, ma'am. Thank you for having me back.
All right, let us know, the Nigerian Center for Disease Control reported cases in some parts of the country, cases of diphtheria. Can you quickly give us an update before we look at what exactly is diphtheria?
Cases of diphtheria in Nigeria have been rising over the past few months. And I know that the NCDC does have numbers on that. And the cases are rising. They've been tracking it, and I know they've been doing a lot of awareness and just sensitization for communities to be aware, but also for hospitals and health facilities. As of September, there were about 7,200 cases that were reported across the countries, and there have been about 400 deaths, over 105-ish local governments across the country, and that's close to the closest data. I think majority of the cases have been in the north, places around Kano, Katsina, Sokoto, Zamfara. There have been a few cases in the south, like in states like Osun, and a very few in Lagos also.
Okay, before we go ahead to know what diphtheria is, why are we recording a sudden outbreak? Because especially all these re-emerging diseases.
So
is this seasonal?
Diphtheria actually, what did you say?
Is this seasonal?
It can be seasonal. It is seasonal, but also parts of the issues would be vaccination uptake. We're having this uptake because there have been some fluctuations and slight drops in vaccination rates and vaccine adoption. That's been the problem, because diphtheria, I would say we've almost not heard about it as a problem in Nigeria for the longest time. There might have been a few cases, but not enough to definitely have an outbreak. You have an outbreak when the community immunity. So diphtheria in of itself can be seasonal, and it tends to occur more in wetter months, so not so much in dry and hot. However, the main problem we are having that's causing this outbreak is vaccination issues. A drop in the rates of vaccination, vaccine hesitancy, misinformation, but also migration and displacement is a socioeconomic factor that can affect, because when people are not where they should be, they're not close to health facilities that they're normally used to, then it can lead to a drop in vaccination rates and then predispose a community to diseases that they normally would have been able to prevent. Again, you can prevent through community herd, basically, which means a community should have a percentage level of vaccination rate, and that is what can keep these numbers down.
All right, so let us look at what diphtheria is, the symptoms, what symptoms the public should look out for in order to keep it at bay, report symptoms early enough.
Okay. So diphtheria is a bacterial infection, okay? And it's a contagious bacterial infection, and it's a throat infection mostly. What people would get is, a sore throat, fever that may not be too high. And then depending on, how attentive the parent is, sometimes some parents will really look in, when the child starts coughing, they look in the mouth, and there might be swelling in the back of the mouth or in the neck where you have lymph nodes. So those kind of things. Now, when the infection progresses, there is a white film or a membrane that covers the throat, and that's very, very typical of diphtheria. They have a specific type of cough, but again, the important thing to know is that once a child is having sore throats and fever, just take them to the hospital, because again, you don't know what type of infection it is, and it would affect their breathing, it would affect them being able to eat and swallow because it's painful. How does it spread? It's mainly, sneezing. Whenever we sneeze, if we had like a microscopic or a camera, when somebody sneezes, you can literally see like a spurt. It's almost like spraying water, you can see, but because it's very tiny, we can't see it with the naked eyes most times. So sneezing, and it spreads the respiratory droplets, and then those respiratory droplets, somebody sneezes, it touches the table, it touches your laptop, you're typing, you take that same hand, you carry a cup, somebody else carries that cup, somebody touches a door handle, and that's how we spread it. So contaminated objects and surfaces, close contact through the air with somebody that is infected, and that's why they tell when you're coughing. Now it's not even coughing to your hand, coughing to your elbow, because the chances that your elbow will touch something, right, is much less than your hand. Coughing to your elbow, coughing to like a napkin or something. Wash hands frequently. Those are very, very important things. But one other thing to note is that on the mild end, it causes just respiratory problems. They have difficulty breathing with the coughing, but on a more severe spectrum of it, it can actually cause heart problems. It can cause inflammation of the heart muscle and cause heart failure. It can also cause nerve damage. So you can have paralysis of different kinds, different parts of the body because of this.
All right. Is this condition... Okay, please go ahead. Go ahead with your thoughts.
And again, like I mentioned earlier, it is a completely preventable illness by getting vaccinated, and good hygiene practices would reduce the spread. Antibiotics can easily work for it, but we hope that parents and family members will be able to detect it early and take people to the hospital when they have it, so they can treat it with antibiotics. But there's also an antibody that can be used to neutralize the toxin, because it works through a toxin release also. And if you can have a neutralizing injection to that toxin, then that can help people recover faster.
Okay, what happens to those that did not receive the vaccine? How do they get this immunity, or how do they boost their immunity or prevent infection now?
Right now, preventing the infection, hygiene practices, just keep your surroundings clean. But the most important thing, go get vaccinated. Nobody is too old to get a diphtheria vaccine. Go get vaccinated. That's really just it.
All right. So can it be treated? How soon can you
Yeah.
get treatment for it?
It can be treated with antibiotics. It's a bacterial infection. It's the bacteria is corynea, so depending, certain types of penicillin-like antibiotics can be used to treat it. But again, what is it called? Resistance patterns can vary, but for each region, aka maybe country or locality, might have small variations. But the best thing is to take the person to the hospital, and the doctors there will determine what works best in that area. But definitely treatable with antibiotics, and then of course support like breathing treatments, IV fluid infusion to sustain them.
Okay, another trending disease out there is meningitis. KB, most states in the north are reporting rising cases. How do we reverse this trending case? And is it also preventable and treatable like diphtheria?
Unfortunately, starting from your second question, yes, it is preventable. It is also treatable when people have it, but again, the treatment is more difficult. So, what is meningitis? Meningitis really is an infection of the covering around the brain, right? We have 3 layers of covering around the brain, and infection of that covering, not of the brain itself, but of the brain, is meningitis. So it's what we call an invasive infection because it's deep inside the body, and it is preventable. Most meningitis. So when we say meningitis, again, it is an infection of the covering of the brain, and it can be caused by a number of things. However, the most common cause, and that we're talking about here, is what we call Neisseria meningitis. That is the bacteria that causes it, Neisseria meningitidis, that causes that type of meningitis. There can be viral meningitis, there can be meningitis from other infections like staphylococcus, all of those things, if they spread to them. But in this case, we're talking about Neisseria meningitidis, and it's also preventable, unfortunately, because there are vaccines for it. There are different strains, and different regions in the world have strains that are peculiar to that area. And Nigeria has its own, peculiar one. There is a vaccine for it. But, we have a vaccine for it. But again, vaccine hesitancy, reduction in rates of vaccination, vaccine misinformation. These are the issues that we're facing that's letting this disease persist. It's also a seasonal infection. There actually is something called a meningitis belt across Africa, and it spans from somewhere at the top of Senegal all the way to the east in Eritrea, drier areas. It's not so common in the south here because it's kind of, wetter and not as hot, but up where you have its drier air, we tend to have more cases up there.
Okay, Dr. Kofo Idowu, thank you so much for that elaborate explanation. How do we prevent meningitis? Is it also preventable? And how do you think we can boost uptake of vaccines? Because we can't preach that enough.
Again, it's preventable. Vaccination. And I know there's a lot of talk about, so yes, there are issues, but nothing is perfect. We have to just establish that nothing is perfect. There's no solution that is 100% perfect. Everything comes with its issues, but we all have to weigh the risks, right? As individuals, as families, as communities, as governments, we have to weigh the risk of getting this vaccine and having some side effects and some issues versus leaving the entire populace exposed, at risk of this debilitating illness. Because meningitis, on the fast train of it just kills. But on the slower, more devastating, people have long-term debilitating side effects that has economic impact. So imagine a family having a grown person or a child that is completely debilitated and they have to care for for the rest of their life. It means that somebody probably has to stop working or reduce their working and earning to care for somebody. So these things are not just about, oh, I'll feel sick and then you get back. They are literal economic impacts and lifelong impacts for this kind of outbreak. So again, we just have to find ways to work with communities to understand the issues and they have, what is driving their hesitancy, and work with them in a way that we can connect with them, understand their issues, and solve specifically for each community. It's hard, but we just have to do it if we need to stem this problem, to educate them in the way that they can understand, meet them where they are, and find ways to just get these vaccine numbers higher.
All right, it is that quite heartbreaking when you hear news reports about death following meningitis and diphtheria outbreak and other vaccine preventable diseases. In North, we had over 1,800 cases and over 29 deaths reported so far. I can say for sure that the government are trying their best to provide vaccines out there, but disinformation, misinformation, and myth and misconceptions could also be a challenge.
Yes, I agree with you. Misinformation and disinformation definitely plays a huge role in adoption, right, of new technologies, old technologies, and things that people, especially we as a people, I have noticed in my own practice and with time that we do have a level of divergence, divergent thoughts and acceptance, and also hesitancy with orthodox medicine. So our people tend to have a mindset of, if it's not a problem right now, I don't see it as a problem right now, I don't need to buy it, I don't need to engage with it. And so the idea of preventing in the orthodox manner doesn't really come naturally to us. And so I think maybe we need to go back to the drawing board and see how we can educate in a traditional way that connects with people, right? Educate our people using just reconnecting with our own customs and traditions. How can we connect the education that is needed for prevention of these things to our customs and traditions in a way that people can innately, attach to? Because I feel like if it's something that comes naturally, then the resistance is less. But they see it as a foreign thing that somebody else is bringing, and then somebody comes and says, oh, this vaccine they are bringing is causing this kind of problems, it's going to limit our population, it's going to make us paralyzed, they are doing it deliberately. So imagine something that you're not so sure of. You're like, yeah, I don't really know them. And then somebody now comes with, oh, it's going to kill you, it's going to cause this. It's easy to just walk away from it and say, I'll take my chances with meningitis, I'll take my chances with diphtheria.
All right. In 30 seconds, your call to action as we wrap up.
My call to action is, for every individual, households, communities, offices, groups, is educate yourself about it. Ask your neighbors, make sure your families and friends are up to date on their vaccinations. Make sure that everybody practices preventive hygiene, practices. Washing your hands, sneezing into your elbows, wiping your surfaces, all of those things. And again, prevention is one thing, but early diagnosis and treatment saves lives. When we miss the first step of preventing, the next step is diagnosing early. So when there's a problem, please go to a health facility early and quickly.
All right, prevention, they say, is better than cure. Early diagnosis is the next big thing when you miss prevention. Dr. Folake Kofo Idowu, public health physician and infectious disease specialist, thank you so much for your time on Sound Health.
Thank you very much for having me.
All right. That was Dr. Folake Kofo Idowu, a public health physician and infectious disease specialist, on how to prevent diphtheria outbreak as well as meningitis outbreak in Nigeria. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Remember, vaccine saves lives. They are harmless and free. Parents, you need to avail your children vaccines during routine immunization. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 08035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.